On your face this Tuesday morning in the final hour of your favorite experience on morning radio. It's Health and Wellness Tuesday. Dr. Paddy Ayete, Elimas Health, Airport Residential Area, and Community 8. Speakers Road. Senior, welcome back.
Thank you very much.
So today, so when I was about to announce the topic, I realized if I had rushed, I was going to be in trouble. So the commonest word I could pick was fibroids. So I went like, okay, we're discussing fibroids, because if I had tried to mention
the uterine part,
I was going to be in trouble. it flashed. Uterine.
Because it's due to the uterus.
Uterus. Okay. Uterine.
It says uterine fibroids.
Uterine fibroids. Uterine. Mr. Alex Mason. Uterine fibroids. Got it right. Boss, what is that?
It's a growth in the uterus. Mainly consists of fibrous tissue and smooth muscle.
What is fibroid? What is fibroid?
It's a fibroid tissue.
What's fibroid tissue?
Fibrous tissue. And okay, now I have to explain what fibrous tissue is.
Exactly.
Okay, it's a connective tissue between.
It's meshy. It's meshy, right?
It is that hard, whitish thing that, if you're eating meat, that lies between layers of meat.
Okay.
So assuming that you're having just eating meat inside your soup, and you take a bite, and then when you bite it, and then there's some whitish tissue that is in between one layer of meat and the other layer of meat.
That's fibrous.
That's fibrous tissue.
Okay.
What we describe as fibrous tissue,
okay,
to put it simply. But it has its functions. It puts things in compartments. It separates things one side on the other side. It connects one part to another part. So it allows the body to function very well. But essentially, with a uterine fibroid, starts with, we call them fibroids because the word is actually fibromyoma.
Oh, okay.
The fibro part is the fibrous tissue, and the myoma part is the muscle.
Okay. Oh, wow.
Yeah. But it starts in a smooth muscle. Essentially, one cell just decides that, all this benko to ben sorry that you people make me do every month with estrogen up, then estrogen down, then progesterone up and progesterone down. I'm not going to listen to your instructions to go up and down and up and down. So one cell just decides that I have decided to multiply and I'm not going to listen to you. And so that cell becomes 2. And that 2 becomes 4.
Yeah.
And the 4 becomes 8. Everybody's doubling.
Oh, so it's growing.
It's growing. And then eventually, so it starts at a very small dot.
And it's inside the uterus.
It's inside the uterus.
As opposed to when we're talking PCS, OS, it was outside.
That's ovary issue.
That was ovary, and it was on the ovaries.
Yes.
This one is inside the uterus.
And so one cell doubles, and then it becomes something that becomes very, very small, like the head of a pin, which you can see, and then it keeps increasing in size. And every month, as long as you're having your periods, you're feeding it.
Oh, wow.
And it grows bigger and bigger and bigger and bigger and coming bigger than my head. The largest I've seen is, I think, 21 kilos. It went into a large bucket.
Oh, wow.
Yeah, it fits. It's bigger than size 34.
And the uterus is where the baby is supposed to grow.
Uterus is where the baby is supposed to grow.
So if this growth is occupying the space, what happens to the baby?
That's the challenge. So depending on where it is, it may affect the baby. So if you look at the uterus like a pear, just like a pear, we've got the middle of the pear is where the seed is.
Okay.
The seed is the baby.
Yeah.
So if the fibroid is close to that portion, it will affect the baby. If the fibroid,
would conception take place in the first place?
If it's at that place, if it's in the middle there, it affects conception.
Okay.
Because it acts like a family planning.
Oh, wow.
But the room has been set for a baby. Everything has been put in nicely. Then you go and put a huge stone or something on the bed that the baby is going to lie on. So when the baby comes,
you won't have a place
to stay.
Yeah.
So then passes. The room is already occupied. You have this large mass over there. So it really affects your ability to get pregnant. If it's in that location, getting pregnant becomes difficult.
Okay.
The fibroid can be in the middle of the muscle, where it is what we call intramural. The first one is submucous. The next one is what you call intramural, which is in the middle of the muscle. And what it does there is that it causes generally a mass effect. So it just grows big, sits in the middle of the muscle. It doesn't affect the ability to get pregnant per se. It can actually push your lining where the baby sits all the way to one corner because that's occupied the space. Then the third category, which we call the ones outside on the outer part, they are the ones we call subserous, but they are the ones that the effect is more on the outer part of the body. So if it presses onto the bladder, it causes you to have frequent urination, but the bladder becomes smaller. The bladder is like a balloon. Press into it, it becomes like a half moon.
Okay.
The volume becomes smaller, and so you have to urinate more frequently. If it presses towards the back, it presses onto the rectum. So it makes it difficult for you to go to the toilet. You become constipated because of a mass sitting over there, making it challenging for you to get to go to the toilet.
Wow.
So those are the effects. And then if it's sticking, then those are the ones that you tend to see sticking out.
The bulging tummies.
When you see somebody and she's pregnant and she's been pregnant for 5 years, yeah, it's most likely a fibroid. That is making her tummy look like that. Or a large ovarian cyst.
How prevalent is this in this country?
It's very common. Very common. Very, very common. In fact, one of the things that I tried to look at when I was doing my postgraduate, unfortunately, I wasn't allowed to. But by another method, in this country, it has been found in between 66 to 80% of women, depending on
various kinds of
Still the same human beings that we have been for how many years?
Millennia.
It really hasn't changed that much. When it's easier to have children, or to have it when it's more difficult to have children. These are the consequences or the implications of my choices. If you decide that you want to have a child you want to wait until you're 40 to have a child, or until you're 30 something, until you have built your 6th house before you have a child, it's okay. You will have the house. Having the children may not be possible because of things like this. You have to deal with older eggs, poor quality. The eggs you have, the number you get is the number you get from the beginning. You have to deal. You don't get more eggs. What you have is what you have. You have to deal with the quality.
No, wait, Doc, hold on there.
Yeah.
What you have is what? Are you not giving? Is the body not producing fresh eggs every time?
No. When you are born with like your 2 million, by the time you hit puberty, you have got 400,000. Every month you lose like 1,000 a month.
New ones are not being birthed.
What you have is what you have.
Oh wow! So the longer you stay without deciding to give birth, then the more challenging it becomes for you.
The more challenging you have. Just think about it. We are talking about fibroids. So the older you get, uterine fibroids, egg quality reduces, egg numbers reduce, and it reduces precipitously from the age of 35. Precipitously.
It just dips. Oh wow!
Deep dive from the age of 35. Then we have to consider hypertension, diabetes, autoimmune and inflammatory disorders, all of which with age manifest, more and more, and all kinds of other problems that may occur. Uterine polyps, worsening health that comes with age, and your ability to even carry. So having children is actually a young woman's game.
Hey, Doc. Young woman between what is young? What is young?
Oh, ideally, between the ages of 22 and 28, you should have sorted out if you want to have an easy
22 and 28.
Yeah, if you want to have an easy process, 22 and 28, yeah, sorted.
But 22, she no finish university. Sir.
Oh, nowadays they finish.
Okay. All right, so we're talking uterine fibroids, but we have to go there.
These are the things that will get us into trouble.
Yeah, those are the things. Let's stick to the list of questions that the producers.
So that we don't get into trouble.
Yeah, so that we don't get into trouble.
I'm passionate about this. Let me explain, because I deal with the people who are in advanced ages.
The consequences come to you.
Yes. And there's a limit to what technology can do. And when you're having this discussion with them, the feedback I get is, I should have done this earlier. I should have done this earlier. I should have done this earlier. I should have made a conscious decision that, something, let me handle this part of my life. Because the joy, on the other hand, when you meet the people who at 55 have gotten up and said, children have finished school, I'm going on holidays now, but I don't have to do anything with all these people.
That's beautiful.
And they are chilling from 55 going. You understand? Or they are growing with their children. So they are 45. And then
the firstborn becomes like their daughter.
Yes,
I see something like that in my house.
They're twinning. They are twinning all over the place.
Yeah.
And then that kind of stuff, because their children are at the age that they can really flow with them, and they are not now chasing. And it's choices. We all make choices, and we live with the choices that we make. But when you have that discussion, it's a lot more, it's difficult when you're talking to somebody who is older and they're expressing the regrets that I should have done it the other way around.
We are not educated at all in these things.
No.
Yeah, because so if I hear that fight happening in my house, I should actually be smiling rather.
Which fight?
You took my this. Why did you take my that?
Oh, yes. Master, they're not fighting with you. Thank God.
I get that almost every weekend. Like,
yes, somebody has won somebody something. And
why did you wear my own? Didn't I buy your own for you? Where's your own?
It is a fight that they would have been having with you otherwise. Entertainment, please. They should carry on.
So uterine fibroids, we're talking about the fact that it could affect fertility and pregnancy. And you are sitting in a place where it is after all the issues have, then they come looking for the miracle. But you say there's a limit.
Yeah.
what is the limit? Let's scare them a little, then we continue with the intake.
No, okay. So if you come with a uterine fibroid, it's small, it's at a particular location, we may look at it and say, this will not affect you right now, so you don't need to intervene right now. That's the advantage of doing an annual checkup, because then we can keep track of it and say, it's becoming a problem or it's not becoming a problem. And if it's not becoming a problem, we say,
go ahead.
You have time.
I mean, yeah.
Would recommend that, have a child or two. If you intend to have children, I make it a priority. Let's work on that process. Let's have our children. Because being pregnant means the hormones that feeds it stop. So it stops growing.
Okay.
It can get into other troubles, but it stops growing.
Exactly.
So it gives you that window. So even by having a baby, the fibroid problem is deferred a couple of years down the line. And if you have 2-3 during the time, it may actually stop growing, and it may give up on the whole process and say, I'll just be where I am because this one is not giving me any space to grow. If we check it out and we think it is significant, we may tell you, this is the significance of it. These are the implications. We would recommend that we should take it out maybe in the next 6 months or next year. So plan towards it. And then when you are taking it out at that smaller stage, you've got options. So a fibroid, if it's in the middle of the womb, where the baby sits, it causes heavy bleeding.
Okay.
If it's in the muscle itself, it doesn't really cause too much trouble until you are pregnant. But if you are pregnant, it can cause you to lose a pregnancy based on where it is. If it's on the outer part, it affects more of the external factors. So it places on the bladder, rectum, tummy bulge, things of that sort. So if it's in the middle of the womb, that is where the baby sits, we have an option. We call it hysteroscopic surgery, which is a surgery that I do. So we put a small telescope and a small instrument through the vagina, through the cervix, into the womb. We don't cut you. We go to where the fibroid is, and we shave the fibroid off in small pieces. And then when you finish, we bring it out from the vagina. Then we tell you to go home. You don't sleep in hospital. You continue your life.
Saying, doc. Just like that.
Just like that.
You're done with the fibroid.
You're done with the fibroid. Go and sin no more. So, and the fibroid is gone. You don't have any. So all those worries.
First of all, how would you even diagnose? Let's start from there.
Okay, so we start with usually it's by ultrasound. So the patient comes, says, I've got a mass on the tummy, and we say, okay, let's take a look. Or comes and say, I'm bleeding heavily, or my periods are longer than they usually are, or I'm having cramping during my periods. So those are the things that they complain about. Or I've noticed that my tummy is getting fat, and I thought it was a bulge, and my husband put his head there. Husbands don't do that very often. I don't know why.
Yeah.
Why do you have a bulge and your husband didn't see?
Husbands should be putting their head on their wife's tummies.
And then he said, my husband noticed that something hard is over there. So we do an examination, and you recognize the fact that it's a mass arising from the pelvis. Suggest that it's a uterus, or you do a scan, and they can realize the fact that this is the mass. If you want more details, CT scan, MRI, all those things.
Okay, some imaging stuff.
So you can actually diagnose and that you actually do have a fibroid. Then the location determines the effect it's having on you and the treatment options that are available. If it's in the muscle or it's outside and it's not too big, you can have keyhole surgery. Small cut in your belly button, 3 smaller holes the size of a pen, and we put instruments inside there, like with fork and knife. We do cuckoo.
Yeah, I've seen that on TV.
And the next thing, the fibroids are all out. We chew up the fibroid and we tell you to go home after a day or two. That one, smaller hole, less pain, less discomfort.
But if it is sitting in the middle,
we remove it from under. Maybe sitting in the middle of the muscle.
No, not the muscle.
In the cavity where the baby sits.
Yes.
Well, that way we go from under, and we take it out.
And if it's a muscle, you do it from the side.
So if it's from the muscle, mainly in the muscle, you can do it laparoscopically with a keyhole, or you can do it open. Open means we give you a cut, which if the fibroid is lower than your belly button, we cut it across like this.
Okay.
If a fibroid goes above the belly button, we have to cut you up and down. I hate the up and down.
Oh, wow.
It's not nice. I mean, I can give you a very good scar. I'm confident in the fact I can give you a beautiful scar. But it's still an up and down scar. You can't wear a bikini anymore.
Doc.
Bikini.
Okay, so we've diagnosed it. We've seen where it is. The options are there. You don't want the vertical.
The vertical one.
You don't want the vertical.
The real line one is not.
You prefer the horizontal.
That one we can hide it in your panty line.
Ah.
So when you look on your tummy, my patients will tell you, look on the tummy, you can't find the scar because it is hidden where the scar is. It's possible to do that. It's hidden in the curve of the body, so you can't find the scar. You understand?
Wait, doc.
Yes.
You are saving a life in one way or the other.
Yes.
Why is the the aesthetic or the cosmetic of interest to you?
That's the only thing the patient sees.
Okay.
You can do everything for her. Give her a bad scar.
She would like you.
You
You saved her life, but she doesn't like you.
doesn't like you.
Left her with a terrible scar.
Got a scar you gave her.
It's 25 minutes past 9, and Dr. Padiayete from Elimas Health is here. We're talking the word again.
You, the fibroids is fine.
Yeah, we're talking fibroids in the
or,
uterus.
Or as our marketing women say, fabulous.
We're talking fabulous in the uterus, uterine
Fibroids.
fibroids. Yes. And then, first of all, what's biopsy and what is its role in there? Why is biopsy?
For uterine fibroids, we tend not to biopsy.
What's biopsy?
A biopsy essentially is that we take a piece of the tissue and send it to the lab to try and find out what is inside.
Okay.
You understand? So we do that for breast cancers. We do that for prostate cancers or prostate enlargements. You've seen a mass. You want to decide as to what is inside the mass. So you put in a needle. You take part of the tissue, and you can do fine needle aspiration, which is what you tend to do for breast. Small needle, chuku, a little bit, and then you take it, put it on a slide. You can do a core biopsy where you use a bigger needle and drill all the way through and take a long tube of tissue.
Okay, all right.
Then you can actually cut you and open and take a chunk of the tissue and send it to the lab. The idea is to find out what is inside, and that will determine the nature of the surgery. So depending on, especially if it's like a cancer that you are looking at, you can examine the tissue and find out this kind of cancer is better if we give you injections first, like medication first, chemotherapy, to reduce the cancer before we go and do surgery. Or this other kind of cancer is better if we do the surgery and remove the whole thing first before, if it will give you chemo, we would give you chemo.
By their definition of multiplication, do fibroids then qualify as cancer?
They are not cancer. They are not malignant.
Okay.
They are not cancers.
All right.
They are benign tumors. However, a fibroid sitting there, a cell inside the fibroid can change and become a
cancerous.
Cancer.
Oh, wow.
And that is why when we take out fibroids, we still send it to the lab for them to come back and tell us that it's a fibroid and nothing else.
Nothing. Okay. Yeah. So what are the treatments? Now we've diagnosed, we've done the imaging, we know where it is. What are we cutting some out? We're cutting all out? Because you're using terms that it's a Tuesday morning. People, it's almost 9:30. You're saying you chew that thing out and pour it out and all. People are having breakfast.
So there are various treatment options. We would prefer that we would have fewer people actually having fibroids. So the focus then is on
prevention. Oh, there's prevention.
There's prevention. And one of the things that causes fibroids to grow is estrogen. And one of the things that gives us excess estrogen is body fat. So the more body fat you have,
here we go again.
The more body fat you have, the more estrogen you produce. The more estrogen you produce, the more you feed the fibroid. So it creates an environment that is very good for uterine fibroids. Delay childbirth. If you delay childbirth, you are more at risk of having uterine fibroids. And the commonest age bracket in our people who have been confirmed to have fibroids are between 35 and 40.
Oh, wow.
They are the commonest people who have got the commonest age that we discover that people have got uterine fibroids. Most likely it started earlier, but that's the age where it typically is doing something to them that makes them come to the hospital.
Oh, okay.
You understand?
What would you do to them? I mean, what we've spoken about. Yeah. Protruding towards pushing this so bladder here.
What you are going to do. So there are things that we can our own lifestyle. If we decide that, as usual, our usual things, live healthy. One of the things that's also been suggested is that if our vitamin D levels are very good, your risk of uterine fibroids are lower.
Vitamin D?
Yes.
The sun one?
Sunlight, yeah.
The one that I need to work on the sun?
Yes. More reason why we need to be out there. And it's been found that the black skin absorbs sunlight less.
Oh.
So even though we have a lot, we absorb it less.
So we need a lot more of it.
So we need a lot more of the sunlight. And we, because of the heat, tend to avoid the sun. So we avoid the sun because of heat. We've got worse absorption. So our vitamin D levels tend to be low.
Is there no other means by which we can get vitamin D? Is it on some food somewhere we can go and eat a lot of?
We still need the sun to convert it. So if you eat oily fish, you get the raw material. Then you work in the sun. Then the sun on your skin converts the raw material into the vitamin D that we need.
Oh, so no matter what, the sun must come in the equation.
I've got capsules. You can give me capsules too if you don't work in the sun.
No, those ones will cost money.
So work in the sun.
I mean, Doc, I worked in an industry where, and I kid you not, the females I worked with, I'm totally sure they never saw sunlight.
Yeah.
I was in banking for like a decade.
Yeah.
Because the time we come to work, there's no sun. And
bankers don't see the sun.
We're talking to bankers, insurance folks as well. All of you, telco, oil and gas, all of you are talking to you. Don't you look at the bankers alone. Because the time we come to work, and the time the banking hall opens,
and the time you close,
and the time we close,
you don't see the sun. If you don't make a conscious effort that I'm going to visit the client, so I'm going out, or I'm walking, I'm taking 10 minutes to just walk down and go and buy.
No. How can you?
We've given you lunch inside the building.
Exactly my point. How are you going out? The lunch is at the pantry. Why are you going? Why are you going to? So that if you go, you come in. Oh wow.
We need to do something about it to give.
And these are things we don't know.
Yeah.
Yeah, but if you're walking on the sun, you sweat and your makeup will be messed up.
Yeah.
And your hair would sweat, and you just did it this Sunday, and all that.
So we have to find a balance, a way in which you can get the light, because you don't need the heat; it's the light that we need on our skin. So that is, so just in short, those are the kind of things that if we did, it would affect our.
And if we don't, risk.
But if the fibroids are already there, then we tell you one. We can tell you we'll wait and not intervene right now because it doesn't need immediate intervention.
Okay.
We can tell you that it may affect your ability to get pregnant, even though it is not big. That means it needs intervention.
Okay.
Because if you intend to get pregnant, let's do it now. We may tell you that it's getting to a certain size that we can use a smaller cut to do because it is smaller and move it by that method. Or we'll tell you that yours is pretty big or too many. So the best option is that you need an open incision.
And wait. What do you mean by too many? I thought it's just one thing growing big.
Oh, I've removed 50 for one person before. You can get a lot.
Multiple
Some
fibroids.
people have removed more than 50. Yeah. Those are horrible operations. I hope not to do some again.
50.
Yes.
In the same uterus.
Cutting. Yeah. After a while, you start asking yourself, why did I even start?
Well, there's no other option.
You're inside already.
Yeah, you have to finish. Oh wow.
Yeah, it can be really horrible.
Multiple fibroids.
Yeah.
That's
like people are having breakfast. We can show you pictures, but
we can show pictures.
We'll show you personally for you to see
that. So surgical removal.
Yeah, so surgical removal. And if the fibroids are big and multiple, it means you have to do multiple incisions. And I give an example that you are wearing a shirt which has got flowers inside. If I'm removing one flower, I can take out the flower and fix the shirt back and can still wear the shirt.
Exactly.
If I'm removing 30 flowers from your shirt,
the shirt is gone. It's not a sieve. Yes. It's like a rag.
Yeah. And that is the problem when it comes to removing multiple fibroids. If there are that many, then you have to start asking questions about the function of the uterus that is left.
Oh, then in that case, the uterus might have to go.
Yeah. I remember a case when I was in Kolebu, my consultant did it, and this young lady wanted to keep her uterus. And we were all telling my boss that, boss, this uterus there, I don't think it will. My boss said, no, he has to do it for her. So he took out the fibroids, plenty, repaired the uterus, put it back. But the uterus couldn't take. So it just couldn't handle the stress. So a few days later, she got a temperature. Then she started collecting pus in the abdomen. We had to go back into the tummy and remove the uterus. So to avoid that kind of calamity, and she was really ill for a while, survived everything.
She didn't have a kid?
No, she didn't have a kid.
Oh, wow.
So sometimes you're going to do the surgery, your doctor will tell you, as for this one, it's better to remove the surgery and live.
You remove the uterus and live?
You remove the uterus, and live, because the surgery, it has taken too long. You've waited too long, so the multiple options that we have no longer do exist. There's an injection that sometimes we give. I have a patient on it right now. If you give it the injection for 6 months, it will reduce the fibroid by about 30 to 40%. And sometimes it can move you from one stage of type of surgery to a different type of surgery.
Okay.
Where the fibroid has reduced.
Because it's reduced in size.
Okay. So then, example, if it's very big and you give the injection and it goes down by 30%, you may not need to do the railroad up and down incision. You can actually do the transverse incision. Or the fibroid may be in a position where it's easier to remove laparoscopically. So you have that option to do a keyhole surgery for that patient.
Came across this phrase as well. What does it mean? Uterine artery embolization.
Okay, it's a process that is done by the radiologists, where you take a tube, a very small tube, and they enter through one of your blood vessels usually in your leg.
Okay.
And they travel all the way up and come to where the uterus is and pass a dye. The dye allows them to see the blood vessel that feeds the fibroid.
The fibroid.
Then they go to that vessel and then they fill that vessel with some kind of plasticky some small blue plastic balls. And those plastic things would block the blood vessel.
Those particular blood vessels, because the dye has shown which one is.
So once you see the dye shows, then you use the instrument to follow the vessel you want to block, the one that feeds the fibroid. Then you block it. Once you block it, the fibroid doesn't get blood anymore, and so it doesn't eat. If you can't eat, what you do? It starves to death.
Okay. So then, what is there a case where a fibroid can fall off itself because it's not being fed and then it comes out?
It won't come out.
It won't come out. It's stuck there.
But let's say it depends on where the fibroid is located. So let's assume, because the scenario you've created, that you have a submucous fibroid that has eventually projected. Because the fibroid can be in the wall, but because of uterine contractions, the fibroid can move location.
Okay.
And then we use that trick sometimes when the fibroid is too big. But the fibroid can then move from within the wall further and further into the cavity, and then is now fed by a thin strand of tissue. Because before it had a bigger surface that it was feeding from, but because it kept moving into the cavity, that surface became smaller and smaller. Now you have a ball that is hanging from a thread. If anything happens to that thread, for any reason, the blood supply that goes through it now stops.
And then that thing is just hanging.
And then that thing is just hanging. And then because there's no blood, it would die. Or because it's hanging, it stretched the vessel, something twisted so that it kinks, you can get the
okay.
Or that fibroid that is hanging can actually come down into the uterus, and the uterus will now be trying to push it out. It will be contracting. It's very painful. And then try to deliver the fibroid. So next thing you know, you examine the woman, she's in pain, bleeding. I had one like that. And the HB would never rise. No matter what you do, she would always be bleeding. Took her to said, madam, just figure out what we can do for you. Examine the thing and discover that the fibroid was trying to come out of the cervix. So we dilated the cervix, went inside, went to the base, chopped off the base. Fibroid came out.
Like childbirth.
Of a fibroid.
Yeah. Yeah. I mean, childbirth.
And then she was fine. She went home very happy.
Any hormonal treatments?
I mentioned that there's an injection that we can give to you.
Yes.
So it's a hormone. It shuts down your body's. Eventually, it creates a chemical menopause, and because it creates a chemical menopause, the estrogen that we've been talking about is not being produced. Because it's not being produced, the fibroid can't grow, so then it shrinks in size.
Estrogen.
Yeah, it starts.
Female hormone.
But the problem with that is that we can't give it to you for more than 6 months, because then your bone starts getting affected because of the low levels of estrogen. So then after 6 months, we have to stop, or give you a break and then go back again.
Okay.
But if you're going to intend to do surgery, it's a good way to shrink it before you can do surgery. Or if the blood level is low, we give you the hormones to make sure the blood level rises enough for you to be able to withstand the surgery that is going to be done.
High intensity focused ultrasound.
Masa, you've done your research. That is something.
I have a very good producer.
That is something. There's another one too about radio ablation.
Okay.
So we've talked about that one too. The HIFU it's new. Years ago, I saw something. It was a cavity ultrasonic machine. They did it for liver cancer, where they use sound waves to break the cancer and absorb it. It was beautiful. And so the result was that once it is done, you can actually remove the tumor. But as it is doing that, the frequency doesn't break the blood vessels. It just breaks the liver tissue.
Well, wait, Doc.
So
you mean it's sound? Sound.
Nothing
else but sound.
Sound waves, yeah.
Hey, what are doing magic in
now? Similar idea. I just use that as an example. Is that we are using sound waves to generate heat in the middle of the fibroid.
To cause it to what? Burst it on its own or what?
Kills it.
Oh, okay.
It raises it to a temperature that it can't withstand. And the result is that it will kill it. But because you can focus it, You focus the heat, the sound waves to a particular spot. If there's when I don't know whether you did when an experiment, take sunlight, focused on a mirror,
I did that.
and cause a fire. Yes. So that kind of focus.
Okay.
That kind of focus.
With a magnifying glass.
Yes. So
I did that.
yeah, but you're using ultrasound energy to do that. And so it's a new method. There's a colleague of mine who is very excited about it. He actually bought an MRI machine. He wants to bring the machine to Ghana. So we are looking forward for him to bring the machine. But we all use some.
He bears the cost.
So we'll pay him the money. So he makes the money too. So it is a new technology. There's one hospital in Nigeria that has it. I don't know their successes yet. But the Chinese are something that the Chinese are very focused a lot of attention on, and they've made some pretty good machines on it.
Oh wow!
Hopefully, to be able to allow us to do non-invasive treatment of uterine fibroids. So you go into the machine, and then it takes images of you with the MRI, and then we actually locate the fibroid, all the measurements, all the dimensions, find the center. Then we program the ultrasound machine to now focus the beam onto the center of the spot that has been chosen by the MRI, and then you hit it.
So wait. This ultrasound we are talking about, we're not cutting.
You're not cutting.
We're just the belly, wherever the thing is targeted.
Yeah, because as the sound is going through the external tissue,
it doesn't hurt.
It's not focused.
Yeah, of course.
It's not focused. So it's like, when a pin touches your skin, the tip of the pin is painful.
Exactly.
It's because sharp point, small area, a lot of pressure. Pain.
Okay, definitely.
Take the back of the pin, the same pin, the head of the pin, larger surface area,
less pain.
Okay. If you press it onto your skin. That's the way it is. So where it is less focused, the sound just goes through without causing pain or causing any detrimental effects. But where there's all of it focuses on, that means all the energy is on a particular spot.
Would the patient feel the pain?
A little bit of discomfort. It's not significant. And the idea is that if we hit the middle of it, there's a distance that the effect goes, such that we destroy the central parts of the fibroid, and the shell that is left to just be absorbed.
Oh wow!
By the body, yeah.
Newer means are coming out to treat this thing, and for you in the industry, it sounds exciting.
Yeah. And then there's a radio ablation one.
Okay.
Where we use waves, thermal waves, but you can add that, you can do it laparoscopically, which is you go to the belly button, find a spot, inject the fibroid with this instrument, and then hit it with the current. And what it does is that it cooks the inside of it, like we use the sound.
Okay.
And also damages the fibroid. So once you've damaged the main fibroid tissue, the rest of it goes away.
You want to send us a message, 0544-321019. 0544-321019. Social media, Instagram, Facebook, and on X, it's at ZFMGH. The TikTok and YouTube, the handle is at Z Multimedia. The website is zmultimedia.com. We're here with Dr. Paddy Ayete from Alimas Health, Airport Residential Area and Community 18. Before we're done, I'll drop his number because the last time when you were done with your show and you stepped out and drove away, the one that you ran away, there's one you literally ran away. A lady walked into the reception because I was also leaving, and I got to the reception just when she got there, and she said, "What was his name?" That's what she wanted to know. And when they said Dr. Paddy Ayete, she said, "Okay," then she left. I don't know what she's going to do with the name.
I don't know.
She's going to Google it.
If I get into trouble, it's your fault.
Yeah, that's the name. I mean, so we'll drop the number that you should be calling now. Still on the non-surgical treatment. The monitoring part that you were talking about, how regularly should it be done?
Okay, so once the doctor sees it and measures it,
every month?
No. It may come every 6 months, every year.
Okay.
They don't grow that fast.
That's why I asked that question, because you don't want to wake up the next day and the thing is bigger than
every 6 months or every year.
Okay, interesting. Let's continue. Someone has asked that. Please ask Doc if insulin and hyperinsulinemia contributes to fibroid growth.
Yes.
But you will explain what that means. I didn't. I was like, you're laughing. Hyperinsulinemia.
So hyperinsulinemia is where your insulin levels are persistently high. That is what we discussed the last time we were discussing PCOS and that kind of stuff. So if your insulin levels are persistently high because of genetics or because of diet, you are creating an environment that allows the fibroids to get a lot of nutrition, and the end result.
The idea is to starve the thing.
You have to starve the thing.
Okay.
I remember someday when Dubai and for a conference, and I was with a colleague of mine. I said, "Did you go for breakfast?" He says, "No." I said, "Why?" He said, "He's starving the cancer cells." He says, "Periodically, you have to fast just to starve the cells."
That's the whole idea of fasting, eh?
So he's starving the cancer.
Starving your cancer cells.
Even though he doesn't have any cancer.
Yeah, he's just starving. He's just starving. Yeah, before they even come.
Before they even come. But an environment that a high sugar environment, a high insulin environment, all of those create a good environment for fibroids to grow.
Okay.
Yeah. And you know the obesity people, they also tend to have hyperinsulinemia. It's all part of the
it's like so long as the body weight or something goes out of,
Charlie,
there's so many issues
that come. Yeah. So many issues that come.
Yeah.
And a lot of times the body weight that has gone high is because of the insulin. That's misbehaving.
One thing leads to another, then to another. And, but we are in a
insulin
part of
causes you to hoard fat, and it causes you not to use fat.
Wow.
So if your insulin levels are high, automatically, you can be exercising like something. The fat is not going anywhere. Because your body is preventing you from burning the fat.
Many times I hear of this fat thing, I don't know, but I'm thinking we're in a part of the world where skinny is not the way to go. You got to put on some flesh.
Recently, my father said when he fell ill, he lost a lot of weight. He was also looking good. So now he must have some fat so that he gets something happen.
Doc, you see, you're on the same page as I. This part of the world.
We don't want skinny.
Skinny,
we don't want skinny.
Yeah.
But you must be at a healthy weight. Recognizing the fact that any excess fat that you have is going to cause problems. And I must also say that our problem comes not from eating the fat, but from eating the excess carbohydrates.
Okay.
The problem is from excess carbohydrates, excess sugars.
Not the fat.
We have blamed dietary fats a bit too much.
Okay.
It is the carbohydrates that our body converts, that stores as fat. So we have to be careful.
This carbohydrate thing, anyway. Ask Doc, the second part of the question is optimal vitamin D levels.
Controversy. All right. So this is
it. Is the answer going to get to you in the Lancet?
No. It's just giving me trouble.
Okay.
So usually the range that the labs would say is that you need to be about 30. For fertility purposes, we've discovered that you should be more above 60. So generally, if you're above 60, I'm happy. But if you are doing, but I have patients who are 17, 12. In fact, most of the people come with problems, their vitamin D levels are low. If we raise our vitamin D levels, a lot of problems would go away.
And the only way to raise it is to walk in the sun or take capsules.
Or take capsules. But the walking in the sun advantage is that you lose weight, you burn fat,
exercise.
Your heart gets stronger, your muscles get stronger, you become more flexible. There are a lot of benefits just by that walking, not only the sun.
But the time you would go walk in the sun, you should be on your way to work. I've seen people when I'm driving to the studio at dawn, they are exercising, they are walking, but there's no sun.
They are getting the exercise benefit without the sun.
But the sun part, you should be on your traffic will go catch you. if you decide to do sun.
So when I'm going to work in the morning and I see people walking, I'm like rich people. There's the rich people who walk at this time.
Exactly.
Because they can go to work at 10.
Exactly. They own their own businesses. They are big folks. I see some diplomatic corps people. Oh boy, if you try, you lose your job the next day. So yes, they're exercising like you said, but they are not. Okay. But how is vitamin D measured for you to say 16, 12, 16?
It's a blood test. So we just do a blood test. We have the machine. We do it every day. So it's not
60 what? When you say 60,
what's the unit? I think it's nanograms. I don't keep the units. I rarely keep the units in my head. I just keep the figure in my head. So we prefer you to be above. If you're above 60, we are happier. But the absolute minimum is 30.
Okay.
But you'll be surprised. One day I'll test yours. Come by. When I come back, we'll test yours.
No, wait.
Experiment. We'll test your insulin and we'll test your vitamin D. You and
DJ Wade.
Alex Mensah.
Yeah, Alex Mensah. And Kweku Youngson.
And Kweku Youngson.
Yeah, the one that you said is Kweku. You said he looks like
I didn't say anything, you said it.
Yeah.
And we'll compare the three of you and see.
No, Alex brags about these things.
Who scores will be good.
We'll leave Alex out. He brags about these things. I'm in top shape.
Oh, let's check out. If he feels it will be very funny to laugh.
Yeah, I think so. Alex Mensah will put him on the spot. Ask Doc again his views in the context of the recent Endocrine Society vitamin D guidelines. Is this person a doctor?
I don't want trouble. You leave me alone.
Yeah, the person will get you into
I'll
the lancet.
Step on toes.
You guys say this guy's not correct, doctor.
We have a problem in our field.
Okay.
And so one has to... Contrary views are not...
too accepted. I know.
It takes a long time before they'll admit that, oh, this was the right position. And
by that time, they would have messed you up.
Oh, that time, Charlie, live. So one has to be a bit cautious about saying, and we saw that at its worst when we had the COVID crisis, where anybody who said anything contrary to what the powers that be said was pilot shamed, you lose your license, all kinds of horrible things. So
it's true.
We've learned to be a bit more cautious about saying that, but this one doesn't make sense. This is actually a better...
if you're going to say it option. And it doesn't go with the UN, WHO.
WHO something, then
you're
you get
trouble,
into trouble. Some guy posted something recently that was really funny. He says, they say mercury in our fish and in our food is bad, but they say in vaccines is okay.
He'll get into trouble.
Yeah. They said aluminium in this is bad, but aluminium in that is okay. It's the same aluminium. How we...
There's a bit of confusion.
I think that... so I beg you.
Can fibroids be removed during pregnancy?
Yes. I don't do it myself. I haven't done one before, but I have a colleague who has done it.
Why is it so rare?
Because it's dangerous. So it's a surgery. The risks are two. One, if she starts bleeding torrentially, you are in trouble. So that is the big problem. And the other risk is that process of playing with the uterus, tampering with the uterus, can initiate contractions that can cause her to lose the pregnancy. So that's problem two. So
there's a certain duration beyond which you wouldn't.
There's a certain duration. So if you are pregnant and you have a large fibroid, we would rather wait. Now, I do cesarean myomectomies, which is at full term when the baby is ready for delivery, you take out the baby, then take out the fibroid. You can do that very safely.
Okay.
It's not a problem.
Okay.
But removing it when she's like a pregnancy is ongoing, they are going to cut the tummy and remove the fibroid. It's possible. It can be done. And if you do it well, you can actually do it and nothing will happen. But you need to, it's a surgery that you don't do lightly. You think about it a lot. And if I tell you that, it is possible and it can be done, the one that we are talking about, there are techniques by which you can actually stay out of trouble. You understand? You circumcise the fibroid, it's a term, you apply a particular something to block the blood vessel at a particular point, not where we usually do it down there, but at a different location. So that when you remove the fibroid, you can control the bleeding and then close it back. So this woman had a bad a fibroid that was actually interfering with the pregnancy significantly and wasn't giving space for the tummy to grow. The large fibroid meant that most of the tummy was occupied.
Okay.
Then we had this space that the baby too was trying to
grow
into,
in,
and the fibroid wasn't allowing it. So he felt that she's going to lose the pregnancy if we don't take it out. So he went in and took out the fibroid.
And it was successful?
Yeah, successful, yeah.
Thank God.
He's a very good surgeon.
Okay.
If I need surgery and
he's the only one you are allowed to touch.
No, if I needed surgery, I would ask him to do it if I was a woman.
Ah, great. His name is Dr. Padiaete.
It's not me. It's a different doctor.
From Elimas Health, Airport Residential Area, Community 18 as well. Please, 0248 07 5568 0248 07 5568. That is the number you should call. If you call us here, we'll also send you there. If you call us here, we'll give you the same number though. So collect the number. Is 0248 075568. You can talk to him directly. I'm sure he won't pick this call though. He will go somewhere and then they'll direct you to him. Dr. Padiaite, final words. Uterine fibroids. Mention it 3 times. My mom is used to be a nurse. She's now home. I don't want her to go and say, I feel. Yeah, I don't want, I want to be safe. Uterine fibroids.
Yes.
Any final words? Our sisters are suffering. So
if I think women should take charge of their reproductive life, and they should plan how they want to. They should be as informed as possible, and then take the necessary steps to ensure they avoid a lot of the problems that comes with in this area. If they have told you have fibroids, it is not a death sentence. It doesn't mean. If there's one thing that people should remember, a lot of people mention the fact that so a woman had fibroids, she couldn't get pregnant, she had surgery, and she couldn't get pregnant, and they blame the surgery for the fibroids, for the pregnancy not coming, forgetting that she couldn't get pregnant even before the surgery.
Okay.
So the fact that your fibroids have been removed doesn't automatically mean that you will get pregnant. It just means the fibroid has been removed. And if there's a different reason why you're not getting pregnant, that problem is still there. So, yeah. It's still there. But fibroid surgeries are pretty safe. Get a good surgeon who will do a good job for you and remove it, and by God's grace, you'll be fine. Having the surgery doesn't prevent you from getting pregnant. You can get pregnant and have children, as many as you want. They say having the surgery means that you may not have. We tend to recommend that if you have had the surgery and we had to cut the uterus, we want you to have a cesarean section afterwards because we don't want the scar to burst.
Okay. And
people say it means that you can't have more than plenty of children. Well, you can have 3 children afterwards and 3 cesarean sections. And I see no reason why anybody should want more than 3 children. So it is fine.
That's another discussion we should have one day.
I'm willing to get into trouble for that one.
Dr. Padiaite, thank you so much for coming through. It's always exciting having you in the studios. He's from Elimas Health. I've given you the number one last time. Please, 0248 075 568. 0248 075 568. Call Elimas Health if you want further discussions on this. It's going to be great. Pass through. I would go there and go get myself tested. Thank you so much, doctor, for coming through.
My pleasure. Anytime.
Have a great day.
Thank you.
So all too soon, the time is up. News at 10. And YA the brand, and the show is The Brighter Side. What else can I say? Hope you've learned. Hope we've made you better informed on so many other things we discussed today. What else? Pray like it only depends on God. But please, go work like it only depends on you.